Hi everyone, welcome to the Learning Resource Center. Today we are in one of our simulation rooms and I'd like to give you a short orientation so you'll feel comfortable when you come here to perform your simulations. First of all, I'd like to introduce you to one of our simulation mannequins, and we'll start with vital signs. So on our mannequins, the left arm we kind of refer to as our vital signs arm, and that's because this is where you're going to be taking the blood pressure and the pulse. Now we will have the cuff already on the mannequin for you. You can palpate a brachial pulse here, but when you're actually taking the blood pressure, you're going to place the stethoscope within the circle here, okay? You're not going to put it here. You won't be able to hear anything if you do that. And so it's manual, so you may want to refresh yourself on the manual blood pressure. And of course, the stethoscope would be in your ears, and you're just going to pump up as you normally would. And what you're going to be listening for is kind of more of a ticking sound. It's not the lub sound that you're used to with a person. So you're just listening for the first ticking sound and the last ticking sound to determine your blood pressure. For the pulse, you're going to press down and then lightly release, and then you should have no difficulty palpating the pulse there. If you find you do have a lot of difficulty palpating the pulse, you can always auscultate on the mannequin's chest and get your pulse that way. Now going to the chest, as you can see, the chest does rise and fall, so you're able to count respirations. As well, as I mentioned, you can auscultate the chest with your stethoscope. Now, when auscultating, you're going to hear the heart rate. As well, you can also hear any adventitious sounds if your mannequin is programmed to have sounds. But please be aware, these mannequins are basically speakers that you're listening to. So there are no speakers on the posterior aspect of the mannequins, so we don't expect you to auscultate or perform an assessment on the posterior aspect, just on the anterior and the lateral. Okay? As far as temperature goes, the thermometers are kept on the walls. And what you're going to do is basically take it out, place it in the mannequin's mouth. Because the mannequin cannot register a temperature, you will hear the temperature through the microphone on the ceiling. For example, you'll hear a voice that says 37.5, and that's your temperature. But we do have to see you actually place the thermometer in the mannequin's mouth before we'll give you the result. That applies as well to the oximeter. You don't even need to turn the oximeter on, but what we do need to see is you placing it on the mannequin's finger. Okay? As soon as we see that, again, through the microphone, you're going to hear a result, for example, 98%. Okay? Great. For your assessments, as I mentioned, you can listen to the anterior chest. You can also listen to the abdomen, this aspect of the abdomen, for bowel sounds. And again, they're not terribly realistic, the bowel sounds. They're more of a click, click, click sound. So if you hear that clicking, that indicates that there are bowel sounds present. We don't expect you to be too detailed because it just isn't possible on these mannequins to be terribly detailed. Either there's bowel sounds or there's no bowel sounds. Working down the mannequin, there are femoral pulses which you can palpate. And as well, as you can see, your mannequin may have a catheter in sight, a Foley catheter. There are spots here for injections. And going further down, you can even palpate a pedal pulse and the anterior tibial pulse. Okay? But if you want to do a full assessment, and for example, you want to determine if there's moisture on the skin, if there is edema, things like that, what we will do is put clues on the mannequin if there is something abnormal. As well, we sometimes will give you clues again through the microphone, but you would have to ask us. You would have to say, "Oh, Mrs. Jones, can you wiggle your toes?" And then through the microphone we'll say, "Yes, she can," or "No, she can't." So, because the mannequin unfortunately can't move for us. Okay, so over here you can see we have a monitor that will demonstrate the cardiac rhythm as well as vital signs. Now, depending on the objectives of the simulation, your teacher may choose to show certain vital signs and hide others, okay? So it just depends. For example, perhaps the teacher wants you to take the blood pressure first, then the blood pressure will show on here, and things like that. Again, all you need to do is when you come in the room, take a look at the monitor and determine what is already visible on there. What isn't, you have to perform that vital sign. Great. And as well, you may have noticed our patient does have oxygen, and we do have oxygen flow in our rooms. We don't have it on at the moment just because it's a bit noisy for videotaping purposes, but your mercury ball does go up and down with a turn here, so you will be able to determine if the correct flow rate is there, and as well you can change it. Okay? And now I'm just going to show you the clock on the wall here. It's important because we will have the clock set to the time of the scenario, not real time. So that's the time you're going to follow, not the time on your watch, okay? Yeah, so if you have meds to give or therapies to give, that's the time you're going to be following, all right? And I'm just going to take you around to the other side of the bed. Something else we have is suction, and that could be for a nasogastric tube. It could be for nasopharyngeal suctioning, and now it does not actually suction, but we would still want you to verbalize, you know, where you would want the needle to be on the suction apparatus. Also, we would want you to check that the correct type of suctioning has been set on the suction machine. So things like that, we still expect you to verbalize so that we know you have that understanding. On this side is our IV arm, and as well you can see our patient has her ID bracelet on, and our patient today is Mary Hartman. Now, there's actually two lines, or it's one line but with two endings. The reason being, one end goes under the bed, and that is actually where the IV fluid runs to, because we can't run it into the mannequin. It would harm the mannequin. So basically, we ask that you ignore that line, okay? And all that you're worried about is the line that goes to the pump. Again, if we wanted you to notice something like For example, there was inflammation or infiltration, we would either put a picture here or give you a clue, write a clue down, so that when you did your assessment, you would see clearly that something was wrong there. And then, of course, we would expect you to assess the pump and do an assessment of your IV fluid, all of that good stuff as you normally would. And something really wonderful about these mannequins is that they can talk to you. So you can actually ask your patient questions and do your assessments. Hi, Mrs. Hartman.
Hi.
How are you feeling this morning?
I'm okay.
Did you have a good sleep?
Yes.
Oh, I'm glad. Are you experiencing any pain this morning?
No, not really.
Okay, that's great. So there you can see that's really one of the best features about these simulation mannequins is that you can communicate with them. And to further that realism, we will have available for you during your simulation a patient chart, which you can, of course, read. It may have physician's orders in it. It could also have lab values, progress notes, consents, things like that as you would normally found, and a second binder, which is the flow sheets and your MAR. So we do expect you to document during your simulation, but we do insist on pencil only in the simulation rooms. Unfortunately, pen does easily mark up the mannequins, and it's really difficult to remove. So we do ask that you please only use pencils in these rooms, and we have them available for you if you forget to bring your own. Okay, I'm just going to walk you over here, and this is one of our medication carts. So you may, as part of your scenario, be asked to administer medication. We make sure we always have IV medication monographs available, a drug guide, and you just need to find your patient's drawer as you normally would on clinical. So you're just going to look, here's Mary Hartman here, and there's her medications. Any needles and syringes you'll find in the lower drawers. And narcotics are here. And med cups, alcohol swabs, IV mini bags, and stock meds, usually things that come in large bottles, you'll find on the bottom. Over here, this is our clean utility room, which is just a cart, as you can see, but it has extra supplies on it that you may require during the simulation. All your IV tubing, IV solutions, oxygen therapy, etc. are on there, extra linens and pillows on the top. This table we call our nurse's station, and that is where the observers will sit during the simulation. So if your role is as an observer, you're going to sit here and watch your fellow classmate perform the simulation, and you'll also be filling in an observer guide so that the information you've observed can be used during the debriefing process. So that's really important. That you fill that in as you're watching the simulation. Now, if during the simulation you wish to call someone, for example, you realize, gosh, I need to call the physician or pharmacy or the charge nurse, what we'd like you to do is use this phone, which is just a prop, and you're going to pretend that you're speaking into it. And again, the microphone on the ceiling, someone, usually a nurse technologist, is playing the role of whomever, will answer you, and you can have a conversation with them. And we do supply you with an S-bar guide here so that you can give a proper S-bar conversation with whomever you're calling. Okay, great. Well, I hope this is helpful for you, and please enjoy your simulation. Thanks. Bye.